Hi, my name is Alex Popadich, and today I'm going to tell you something that's unique about my practice. And that is that I'm currently the only breast surgeon and menopause specialist in New Zealand, and possibly even the world. And you might ask, why does this matter? My story starts mostly in operating theatre and surgical clinics, where I trained to be a breast and general surgeon. But something eye opening happened to me when I took over a private practice of a male surgeon who was working there before me. Suddenly, women started sharing concerns about symptoms they were experiencing. Some of them were related to menopause, some of them were related to drugs we as a breast surgeons were putting patients on, which were also linked to menopause. But most importantly, they felt comfortable talking to me because I was a woman. Or maybe I was just interested in hearing their story. As you see in a breast care, menopause isn't just a side story, it's actually center stage. Many of our patients take medications like tamoxifen or aromatase inhibitors, which can trigger intense menopause like symptoms. Others may experience menopause due to chemotherapy that they had for treatment of their breast cancer. And some might go through menopause after they gone through all of the treatments of breast cancer and are not on any medication. But during my medical training, we actually weren't taught how to deal with these symptoms. And yet, majority of women were experiencing, especially us as a surgeons. But actually, in New Zealand, probably surgeons see these patients more often than medical oncologists or radiation oncologists. We see all of the breast cancer patients, but medical oncologists might just see the ones who've had chemotherapy. The radiation oncologists see the ones who've had radiation only. So there is a group of people, then actually we are the only people who take care or who can answer their questions about these symptoms. Hence, I think it's really important to have people who are breast surgeons as well as menopause specialists. But unless you go through things like patient does, like menopause, it's really hard, even as a woman, to understand what's going on. I have had friends who've gone through easy menopause, nothing happened. And so they didn't have symptoms. So it was very hard to compare things or to understand how it is. And maybe a lot of male doctors feel exactly the same. They're actually interested in finding what the symptoms are, but they don't understand the severity unless you go through it. And this is what happened to me. I started going through perimenopause. And in the beginning, I actually didn't know it was perimenopause. I was in a crappy mood. I was tired. I was bleeding a lot. But most people don't talk about it. Not even us doctors. Actually, sometimes we're the worst ones to talk about it. But all of a sudden, eventually you realize you are in perimenopause. And as a medical doctor or especially a surgeon who's used to being up all night or operating during the night or having lack of sleep, nothing prepares you through this because mostly in our training, we might have one or two or three sleepless nights in a row, but eventually you have a night off and you are able to sleep, or you have to take the half the day off or a whole day to be able to sleep and then provide good health care. But in menopause or perimenopause, it doesn't just stop, it continues. You often wake up at this awful time at 3 to 4 o'clock in the morning and you can't go back to sleep for an hour or two or three. And then just as you've gone back to sleep, bloody alarm starts going, "Bing," and you wake up and you have to go to work. It's okay if it happens once or twice, but if it's gone on for months or years, it's just horrible. You just feel like crap. You don't want to do anything. You don't have energy to do it. The other symptoms that often would happen is the brain fog or a struggle to find words. Sometimes I should understand how that feels. English is my second language. So it felt a little bit, okay, I cannot remember that word. But then it was about words I was using every day. I would start to talk to a patient, and then all of a sudden, what's that word? And the word is like cancer or surgery or lumpectomy, stuff that I use every day, and I couldn't remember. And it was impacting how I would explain symptoms to my patient. And then you start thinking, am I having early Alzheimer's? What the hell's going on? And then you get these joint and muscle aches. I used to play basketball competitively during my high school. And I was used to that tired feeling or sore muscles because you've done something. But this is just weird. It's there. It just sits there and nags at you. And all you have to do is just sit down because everything you do is sore. And because of all these symptoms, I could finally truly understand how my patient felt. So this unique combination of personal experience as well as my background has encouraged me to rebrand this YouTube channel and talk more about this. In my experience, many women have been quite reluctant to talk about menopause symptoms with their doctors, whether they're GPs or medical oncologists or radiation oncologists, but especially breast surgeons. I think it's because surgery has always been associated with more of a male workforce. But I believe we should be able to talk about anything because every little thing has a potential to help some. And we also have to remember that every woman's journey or symptoms are unique and different. And what we talk about or what I talk about might not apply to everyone. In the upcoming videos, we'll talk about different topics from generalized breast cancer knowledge to menopause treatment to little tips and tricks of dealing with things as well as knowledge in general. This is because good healthcare means having a complete picture rather than just treating individual symptoms. Thank you very much for watching this video. This channel is here to empower you to ask questions of your medical specialist that you might otherwise hesitate to discuss, but that will lead you to achieve better health and better lifestyle. Bye for now.